So Dr. Aditi Gupta is speaking on intercalary membrane break and detachment causes intrachoroidal cavitation in macular coloboma. I think still half a minute is there. Yeah, you can start. Thank you.
Good morning, everybody. My presentation topic is intercalary membrane break and detachment causes interchoroidal cavitation in macular coloboma. No financial disclosures. So macular coloboma is a rare, unilateral or bilateral, pigmented or non-pigmented, non-syndromic developmental defect of the eye located at the macula, characterized by well-circumscribed, oval or rounded, atrophic lesions of varying size presenting rudimentary or absent retina, choroid, and sclera, leading to the decreased vision and sometimes other symptoms such as strabismus. It occurs due to incomplete arcuate bundle differentiation along the horizontal raphe during embryonic development or may result from intrauterine infections such as rubella, measles, or even Toxoplasma gondii. Here are a few images of different types of macular coloboma which have been seen in the literatures. Interchoroidal cavitation, now we come to as a structural features which is seen on OCT and is characterized by presence of a hyperreflective area between the unaltered RP and scleral boundary. It can either be peripapillary or macular in location. The pathological myopia is generally located with, associated with ICC, more commonly at the peripapillary location. So macular ICC associated with macular coloboma is quite a rare finding. There are two studies, one in when Schoberger and Agarwal published two cases of grade 3 NCMD with macular ICC. Here both the patients were associated with posterior cephaloma and visual acuity was in the range of 2040 to 2060. There's another study where Markin et al. Demonstrated ICC due to the detachment of intercalary membrane in a case of iridoretinocorneal fundal coloboma. But no classification system is really given in the imaging of macular coloboma in the literature till date. So in this study, we aimed to diagnose and understand the pathogenesis of ICC in macular coloboma using multimodal imaging. We took a retrospective image analysis with patients diagnosed with macular coloboma between 2017 and 2021, whose color fundus photography, OCT, and multicolor imaging was done. So basically, on the OCT, we saw that there were three particular features which we were seeing, either whether it was conforming or non-conforming type of macular coloboma, the presence or absence of ICC, and the presence or absence of break in the intercalary membrane. In the conforming type, the intercalary membrane or thin retina conforms to the excavation of coloboma, while in the non-conforming type, there's a separation between the intercalary membrane and the base of macular coloboma. ICC was identified on the raster volumes OCT scan by presence of a hyperreflective space beneath the unaltered RP. On the on-fast multicolor image, two features were identified. One was the dark hyperreflective areas abutting the margin of macular coloboma, which is suggestive of an ICC, and the second was the presence of orange-colored boundaries surrounding the ICC. In the results, we took total 16 eyes of 11 patients who were already diagnosed with macular coloboma. Their ages were from 12 years to 58 years. Unilateral involvement was seen in 6 patients, while 5 patients had bilateral involvement. On the OCT, the conforming type of macular coloboma was seen in 9 eyes, while the non-conforming variant was noted in 7 eyes. Macular ICC was noted in 5 eyes of the 16 eyes. In all the 5 eyes of ICC, there was break in the intercalary membrane. Eyes with no ICC showed no intercalary membrane break, and none of the conforming variants showed ICC. In all the 5 eyes with ICC on OCT, there was a dark hyperreflective area surrounding the margin of the coloboma in the multicolor image, as I already stated, and the orange color boundary surrounding the dark hyperreflective area was seen in 4 out of the 5 eyes. This is a demographic analysis, which I just mentioned. So here are a few examples from the study. So here is one figure which is left eye, which shows a pigmented variety of the macular coloboma, which is the conforming type. Then the second image, we can see a vertical line passing through the macular coloboma. The margins of the macular coloboma are delineated with the white arrows, and it shows the intercalary membrane continuous with the excavation of the coloboma, which is suggesting the conforming type. And no break of the intercalary membrane is identified in this, and also there is no intrachoroidal cavitation. This is another example in the study where we can see the pigmented variety of the macular coloboma. The margins are marked with the white arrows. The OCT shows that the margins of the maculocoloboma is white with the white arrows. The intercalary membrane is marked with the yellow arrows, while the sub-ICM space or detachment is denoted by the pink arrow. There's no break in the intercalary membrane in this also, and no ICC. This is a third example which shows the pigmented variety of macular coloboma. Here we can see that it's extended beyond the margins of the coloboma, and the dark green patches are noted which correspond with the areas of the intrachoroidal cavitation, which are shown by the red arrow. There's no orange color boundary in this case. It shows the intercalary membrane break shows by the blue arrow, thereby so you can see in the ICM space of the detachment, and this has been described as a non-conforming type of macular coloboma. Here the ICC is noted as a hyperreflective space beneath the unaltered RPE. So macular coloboma can be of two types, the conforming and the non-conforming type. The conforming type is further divided into the one which has no intrachoroidal cavitation, and the non-conforming has the one with no intrachoroidal cavitation and with the cavitation. It is described like I already did. So in conclusion, we can say that ICC is seen in all eyes with non-conforming macular coloboma with the presence of intercalary membrane break and detachment on OCT imaging. These are identified on multicolor imaging as dark green areas abutting the margin of the coloboma. The limitation of a study was lack of information on long-term changes in eyes with or without ICC, and the take-home result is that eyes with macular coloboma tend to show intercalary membrane break and detachment and needs to be followed up at regular intervals for checking the development of ICC. Thank you.
I think the major role of multicolor imaging is the basic thing.
Yes, sir.
So what is the cost for this? Yeah. So, you don't know, doesn't matter. Thank you very much. Yeah, it's the new technology which is coming, it is being made applicable to all these things.
Just one question. In your series, you didn't have any retinal detachment. What could be the reason for that? There was a break in the intercalary membrane,
Yes,
but
sir.
no detachment.
So the retinal detachment might have occurred later in those patients. These are all a retrospective study. So we couldn't follow up. At that time it wasn't there,
Yeah.
but maybe later on it might have happened, but we couldn't these patients were done like retrospectively. So we already had the images and we tried to analyze them.
So you need a long-term follow-up for that.
Long-term
Yes.
follow-up is definitely required in such patients. That's what is the take-home message.